everybody. I am Dr. Urvi Maheshwari, consulting physician and diabetologist at Zainova Shalby Hospital, Ghatkopar, and today on this dais we'll be having a discussion about milk, which is consumed by all of us, the infants, children, adults, the elderly age group, everybody. But do we all know whether today's milk is pure, impure, whether it should be consumed or no, what are the benefits, what are the side effects, etc. So today here I have with me my friends, my colleagues, my panel of doctors, the orthopedicians, the pediatricians and the dietitian. Dr. Dhananjay Parab, he is an orthopedic surgeon plus a joint replacement surgeon. Dr. Chintan Doshi, he is a pediatric orthopedician. Mrs. Jinat Patel, she is our dietitian. Dr. Richa Chourasia, madam is our pediatrician, and Dr. Shruti Ghatalia, our pediatrician. So today we will be asking them the question, so whether taking milk is important or no. So should we take milk or no? So Dr. Chintan, can you elaborate whether milk should be taken in children, what are the benefits of it, and how important is milk in children's?
Yeah, so to begin the discussion, let's begin with a jingle that we have and all of us are very familiar with. So we have all heard this. So let's give 30 seconds to this jingle. Right. So as we all heard, that milk is very important, and there have been multiple. I don't know why are we having this discussion as well, but it has been centuries that we know that consuming milk is important for our health, for our bones, for overall development and growth. So yes, it's very important for children to have milk. It depends on what type of milk they have, depending on if they have allergies or if they probably cannot consume animal milk or cow's milk. But then it is important as some portion of calcium that goes into them along with. So milk is just not important for calcium. All of us think that milk means calcium, white is white, but no, milk has a lot of other things. It has high quality protein, milk protein we call it. It helps in building overall cells and other tissues of the body as well. It has vitamin B2, B3 which generates energy. It also has vitamin A which helps the immune system. And B12 which is important in red cell formations and other things, also other important nutrients in the milk. So yes, milk is very beneficial for children. There are some children who cannot have milk, as I already mentioned, because of allergies, but there could be some substitutes that could be used for those. But then apart from that, considering the growth of the child and the age group of the child, a certain portion of milk is important. If you go into the quantity, how much milk should be taken, then for a kid who is around 1 year, before that is mother's milk only, no substitute, no over-the-top milk from there. And then from 1 to 5 years would be somewhere around 2.5 cups of milk, when 1 cup is somewhere around 200 to 250 ml.
Okay.
Beyond 5 years to 10 years would be somewhere around probably 2 cups, if not at least 1 cup, if possible, if they can consume. And then beyond that is depending on the growth and whatever is the nutrition requirement. If they are taking a lot of other things, which includes calcium, if they do not take milk after 10, that is also fine. But then it is something which is important for our growth and development as the child grows.
So as a children, even we used to have 3 glasses of milk a day. Right. So is it important to consume 3 glasses of milk a day?
So 3 is a little too much. If you consider that you're taking a full big glass, then it would be somewhere around a liter or so, means 750 ml to 1 liter in a day. Then that will compromise on your other nutrition, other intakes. Then you will be full by stomach and you will not take other things. But it is always better to space out your milk intake. So you take 1 glass in the morning, right, during breakfast, and then probably once in the snacks between the lunch and the dinner. So that you don't compromise on lunch and dinner, you don't compromise on other times when you are going to eat healthy, nutritious food.
Right, true. So, Dr. Dhananjay, can you tell us, is milk important in adults as well? Should we adults consume milk, and if yes, then how much?
See, as Dr. Chintan said, pediatric age group is very important. Why? Because whatever we are taking, whatever nutrition we are taking at a child's age, that will decide your bone health at an adult age. So if you're not taking milk from the beginning, your bone health, got so many deformities. Rickets is there, scurvy is there. So whatever deficiencies you can see in children, the same thing will be. The consequences are seen at a geriatric age group. So then at that age, now I am a joint replacement surgeon. So we see knees daily. So in these age groups, we have seen so many people who have very weak bones. The bone content, the bone mineral density is not good enough. So that leads to complications, that leads to various diseases in the older age group. So I would suggest, as sir said, you start with milk right from the beginning, and even at adult age group, you have to have dairy products. Yes, you can't take milk, somebody is allergic to milk or something is there, but then you have to have some dairy product, maybe low fat or something like that. Yogurt is there, people like yogurt, they like chas is there, buttermilk is there. So you take those dairy products, and 1 cup, 2 cups a day is not, it is not harmful. You have to have milk or dairy products. You can have plant beverages which are almost similar, especially soya milk is very important. So why milk? Because it is very rich in calcium, it is very rich in minerals, it is very rich also in vitamin D. We don't get that vitamin D, amount of vitamin D from sunlight, because we are busy in our life. So vitamin D is also a very important vitamin which is needed. Why? Fat soluble vitamin. It is very important for intestine as well.
Right.
So all these features are covered by milk or dairy products. So I would say that adults, especially elderly, should have dairy products daily. That will be important to have a good bone stock. They will be able to mobilize freely. They will be able to move. If you have a good general health, you can be independent. That is more important.
Okay, as a physician, so we have seen our patients, because the milk contains cholesterol, fats. So we have seen patients developing coronary artery diseases also due to high deposition of cholesterol also.
Absolutely.
So what is your say in that? So should you still suggest taking milk is important?
See, the milk, again, you have to have the right portion, right amount of, you can't take many papers, there are many articles who suggest that a large amount of milk can cause coronary diseases.
Right.
The large amount. But our diet is not sufficient enough to give calcium, the whole diet, nutrition. So we have to have some amount. It is not, you can have a cup, one single portion of dairy product is sufficient enough to provide good amount of calcium.
Right.
So and plus that also prevents vascular diseases, diabetes, obesity, that some amount of factor, obesity, diabetes, coronary vascular, it's a multifactorial disease always. So some amount from everything is needed. So even dairy product is also needed in certain cases, but in equal amounts. I mean, you should not just drink milk, just have eggs. That is going to cause a problem.
True.
But it should be equalized. It should be a balanced diet. That is what is needed.
Okay. So here our orthopedicians are of the opinion that milk has to be consumed in children and adults so that you can have a good growth, your strength of the bone, plus rest of the diseases. Also the milk does not only provide us calcium, but it also provides proteins, vitamins D and other resources also. So, but then I have heard a few of the pediatricians saying that milk is not that great, not very necessary for humans, as only we humans are the ones who drink milk of the other animals. Nobody else does. So what our pediatricians have to say on that? So the pediatricians, can you tell us, should milk be consumed? How important it is? Madam Dr. Shruti, can you elaborate?
Yes, so being a pediatrician neonatologist, I'll start from the newborn. The very basic thing to understand is Cow's milk is for a cow's baby. Human milk is for a human baby. You can imagine the difference. Do you think both milks will be the same for the requirement of nutrition for both those size babies? Very simple to understand. Okay. So for the first year of life, just give breast milk. Do not start cow milk. When people start cow's milk, what happens to their kids? Now, see, first and foremost, the cow milk has a lot of solutes and proteins, which are very difficult for the human newborn or infant, that is less than 1 year baby's kidney to handle. So there is a lot of solute load on the child, and in such children, especially if water is not given enough or there is dehydration in the baby, there will be perspiration in the coming months, these kids will become very ill. Their kidneys will not be able to handle the cow's milk. So that will be the first problem that they will have. Another problem is when we start cow's milk, a lot of these children have lactose intolerance. So you will find them becoming cranky, getting colic, they get diarrhea, nausea, vomiting. They are very, very uncomfortable symptoms which are there, and the baby, poor guy, cannot tell you that I am suffering. Okay, so that is another thing, the lactose intolerance, because lactose is a natural sugar which some babies cannot digest, which comes from the cow's milk. Third, very, very important thing, cow's milk will prevent the iron from getting absorbed. It itself is poor in iron. And what happens is when we give a lot of milk, mothers are reassured. मैंने आधा लीटर दूध पिला दिया है. They don't take the baby after 6 months on solid food. They are happier giving half a liter, 1 liter of milk and think that their job is done. In the process, what happens is these children become iron deficient. They become anemic. They do not get proper nutrition because there is no iron, no vitamin C in the milk. Because they are on milk diet, they become constipated. The protein in the milk will irritate the intestine and there will be minor blood loss. This will again increase the anemia in these children. And it has found that children, there is a study which showed that children less than 1 year, if they are anemic, their IQ at 5 years will be 5 points less than a child who was normal in the first 1 year. And by then it will be too late for you to take care of the anemia and improve the IQ. So we see a lot of anemic children. We see all of these children are constipated. Too much of calcium, too much of milk leads to constipation also. Because the tummy is full, they don't go on healthy, actual, nutritious, solid food. And so there are those deficiencies in these kids as well. And therefore, all this is a major problem for which definitely no milk, top milk till 1 year of age. After 1 year of age, we do require a bit of calcium. So how much calcium is 1 cup giving? 1 cup of milk is giving you 300 milligrams of calcium. What is the requirement for your child? 700 milligrams of calcium. So just 2 cups, not more than that, not 2 glasses. 2 cups are enough for your baby's calcium. Now tell me, is it only milk that you're going to give for calcium for your baby? We will talk about all the other things from which you can get. So it's not 2 cups of milk, it is 2 cups of milk or milk products, which is very important. Try to give everything to your children and don't concentrate just on milk. Some kids are also quite allergic to milk and it is a major hassle. Isn't it, Dr. Richa?
Yes. So, as Dr. Shruti said, I would like to tell more about something called as cow milk protein allergy. So, less than 1 year specifically, the kids, the intestine, basically there are some proteins in milk which the child is allergic to, which the child can be allergic to, and can lead to various manifestations or symptoms in the child, which can be respiratory, leading to recurrent cough and cold. Recurrent wheezing can also happen. The child can have intestinal, gastrointestinal symptoms like loose stools, vomiting, frothy stools, which can lead further into failure to thrive. The child will not gain weight. Further, there can be skin manifestations as well. There will be rashes, eczema, secondary to the cow milk protein allergy. So, and cow milk protein allergy, the incidence is around 5 to 7% in less than 1 year, which mostly as the child grows, and mostly by 5 years it settles down. So many are there will be questions, what is the difference between cow milk protein allergy and lactose intolerance? So see, cow milk protein allergy is because of a protein in the cow milk which one child may be allergic to. Lactose intolerance can be of two types, primary and secondary. Primary means there is deficiency of an enzyme called as lactase in that particular person. Secondary, it can be because whenever there is diarrhea, there is loss of intestinal epithelium which causes decrease in that enzyme, so it can be secondary. So if a person is primary lactose intolerant, then he will lifelong be lactose intolerant and will not be able to take high quantity of milk. While they can still take some quantity of milk. It is not that they completely cannot take milk. They can take around 150-200 ml of milk. Lactose intolerance will not cause a problem with less quantity of milk. But cow milk protein allergy will cause problem even with low intake of milk. Secondary lactose intolerance is after diarrhea. So what happens when the diarrhea is controlled and the baby or the child is fine, then the person does not have any problem with intake of milk. Next thing I would like to say about milk intake is, whenever there is a high milk intake, whenever any doctor or any person suggests about dairy intake, a good dairy intake, the parents think that a dairy thing is very important, which is very much implicate further told in India in all the households, that intake of milk is very, very important. The intake of green leafy vegetables is not so much told as the intake of milk is told about. So what happens that for bones we are saying that milk is important, but what happens for bones, it is not only calcium that is needed. Bones require many other things. They require vitamin A, C, D, K, many minerals. They require physical activity. Physical activity is very important for the development of the bones, for the bones to be strong in kids. So when we tell too much about milk intake, there is no balanced intake of the other food materials, and that is why the other minerals or the other vitamins which can be taken from other food items, that goes down. Also, increase in calcium causes a relative deficiency in magnesium. That also further affects the bone growth. Also, increase in phosphorus decreases the calcium availability in the body. That further affects the bone growth. Also, this is the second point. Third point is in the last some years, maybe after 1990s, I would say there was an increase in the consumption of milk. However, the production was not that much. So suddenly, whatever the milk industry was there, dairy industry was there, they have started from that time. There was too much of advertisement about milk, too much of hormones being injected into the cows for faster milking from the cows, for more amount of milking from the cows. So all this also, when you are drinking that milk, you do not know how they have breeded that cow, where is the cow from, you don't know anything. And then the hormones you are taking the pollutants, you are taking the pesticides. So and also, as Dr. Urvi said, that milk is species specific. So have you ever seen a cow drinking a goat's milk? So every milk is species specific. The cow milk protein has certain proteins which is very high in casein. Casein protein, such high casein proteins is not good for babies, especially less than 1 year, because it is forms a thick indigestible curd kind of thing, which is very difficult to digest by the babies. These are the points that I would like to say about cow milk.
So, Dr. Richa, so what do you suggest? Of course, we got the concept that a child below 1 year has to have only mother's milk and no other cow's milk. So, what is your say on buffalo's milk? What is better? Should we intake buffalo's milk or cow's milk, or absolutely no and go for other substitutes?
Yeah, so less than 1 year, I would say no milk other than mother's milk, breast milk. After 1 year, after 1 year, and if less than 1 year the mother is not able to breastfeed the child, there are some problems or any other issue, mother is not getting the breast milk, then definitely formulas can be used, because formulas have been simulated to be kind of made to be like the breast milk, although it cannot be exactly the same. Breast milk is the best. But if not breast milk, then formula milk, cow milk or buffalo milk is a big no before 1 year of age. After 1 year of age also, if you have to compare cow milk versus buffalo milk, I would prefer cow milk, because buffalo milk is very high in proteins and fats, which is not good for the digestion, and it is difficult to digest. In some conditions, when the child requires more of fats or proteins, then you can give buffalo milk, but not as on a regular basis.
So I think the animal milk seems to be little dangerous. So we should go for plant-based milk.
So yes, recently there is much hype. Okay for adults, I would not say no for adults who are towards veganism, but I will not advise for less than 5 years, because there was a study done in Switzerland where they have compared the protein, carbohydrate, vitamins, minerals and amino acids, all these of both the cow milk and the plant-based milk. So they have found a significantly less amount of protein in the plant-based milk. It is less than 1% in the plant-based milk. So such less proteins and such less amino acids, fats and minerals is not good for less than 5 years. That is a growing age. Development of the brain is happening. So plant-based milk is a big no before 5 years of age. Also, the indispensable digestible amino acids is also very less in plant-based milk as compared to the cow milk. So cow milk is okay, as Dr. Shruti and everyone is saying, in moderate amount, in appropriate amount, and not too much of on drinking too much of cow milk. But yes, you can take a limited amount with appropriate balanced diet of all other, as much of, as we say, pediatricians say, rainbow vegetables and fruits, as many kinds of different colors of fruits and vegetables, different kind of flours, cereals that you can take throughout the day. Even if for non-vegetarian, if you can take an egg a day or other fish, chicken, whatever, if you are a non-vegetarian, that is more diversity of the diet is what we want to reiterate all the time, and not tell too much about milk, too much intake of milk.
Right. So you pediatricians are saying, I guess, more no for much of milk. So Dr. Shruti, can you tell us what are the different substitutes? If I want to not give milk to my baby, then what are the other things can I give to my kid so that he does not have a bone disorder and land up to orthopedicians in future? So what are the other substitutes for milk?
Correct. So two things are very important when I don't want to send my kids to them: calcium and vitamin D.
Right.
Right. So vitamin D basically go in the sunlight except from 11 in the morning to 4 in the evening. So even if you go say a few days in a month, your vitamin D levels are good. Okay. So that is one thing which is very important. Of course, non-vegetarian food, you will get salmon and tuna, you will get your vitamin Ds. Now, so far as calcium goes, how much calcium do we need? Actually, 700 milligrams per day.
Right.
Okay. And if your child is say 4 to 8 years, maybe 1000 milligrams per day. So 1 cup milk is equal to 1 cup of pudding of milk base is equal to 56 grams of cheese. So is your child eating all of this? Then why are we harping only on milk for calcium? That is one thing. Second thing, what are the calcium stuff? Where else can our kids get calcium from and not get bored with that same glass of doodh? So first and foremost, green leafy vegetables. I think not only calcium, you get a lot of iron, you get a lot of vitamins, because milk itself, just milk will also lead to iron and multivitamin deficiencies. So green leafy vegetables, broccoli is very good. You have seeds, you have sesame seeds, तिल गुड़ का लड्डू. हम लोग संक्रांति पे पतंग उड़ाते हैं धूप में जाके और तिल गुड़ के लड्डू खिलाते हैं. You are sorted with your calcium and vitamin D requirements. Right. So sesame seeds, just roast them and put them on the salad. Put them when you're baking something, just put the sesame seeds in the bread. that is a very good source of iron for our kids. तिल का चिक्की बना के हम लोग देते हैं, so that deshi good will give you iron and sesame seeds will give you calcium. Sunflower seeds, chia seeds, these are all good in care. Now, what about the fruits? The commonest, take orange and papaya. These are available to us so easily, and they're very good in calcium content. Okay. Dry fruits, almonds, apricots.
Right.
These are very good in calcium content. So you give a diversified thing. You don't need to give just one glass of liquid. Give it a diversified thing. That you will get other nutrients also along with just that calcium for your child. We are not saying don't give milk, but more than 2 glasses, 2 cups of milk, certainly don't give. So
Right.
that is the message that we would like to send across.
True.
And like Dr. Richa said, my plate, a healthy meal. At 1 year, our babies should be eating what we are eating. See, just giving too much of milk, you are diverting your attention from actually giving the solid food that the child needs.
Right.
So if the child is taking 3 healthy meals with good iron containing solid food, it's okay if they take 2 glasses of milk. But the other part is very, very important. So in your plate, half of the plate should be fruits and vegetables. About 1/4 should be carbohydrate, 1/4 proteins, I'm saying generally, and 1 small cup out there has to be a curd. So for us, curd, I think buttermilk curd is a very, very common calcium containing food that we take in our Indian food. So our thali is perfect actually.
Right.
These are the messages that we would like to send.
Excellent discussion. Now let's see what our dietitian has to say about milk, whether we should consume milk or no, and how much, and what should be the composition of the milk we take. Madam.
So today we'll do the post-mortem of milk. So what is the composition of milk, that is most important. So all the discussion that we have made is actually has given you all the answers to why and why not. So firstly, if we say about the proteins in milk, it is casein and other is whey. Okay, so casein has 80% of digestibility, and wherein whey is 20% digested, and casein helps in the absorption of calcium. That is why milk can be a good intake of calcium, but the plant-based foods that are having fiber, they have higher digestibility of calcium in the body than the milk. Okay, so whenever we just spoke about the pyramid, that is the food pyramid or the food plate that we talk about, 50% of the thali should be consumed by your whole grains and your salads and green leafy vegetables, so which is giving you fiber and proteins, and the other protein that are coming from legumes, that would be another 30% of the pyramid or the thali. The rest remaining 20% is your milk and milk products. Okay, and now when we talk about the fats in milk, there is trans fats. So when we discussed about the coronary artery diseases, yes, it is affecting if there is an increased consumption of milk. So the requirements come from the RDA, which is the recommendatory dietary allowances for children. It is 700 mg, correctly said by Shruti ma'am, and then the for adults it is 1000 to 1400 mg per day. So now it is not necessary to only binge on drinking milk throughout the day to get that calcium. As I likely said, casein helps in the absorption of calcium. Okay, so 2 cups or 200 ml of milk at a time in a day is more than required. Other calcium sources ma'am has already discussed. From plant-based, we have soy-based products also giving you good calcium. Then fibers coming from plant-based green leafy vegetables. So one more important thing, that iron and calcium. Okay, we haven't discussed it yet, but even with supplements, doctors never give iron and calcium together because they bind. Other binding factors are your phytates and oxalates, which are also present in plant-based foods. So you need to process that while cooking. So you remove the phytates, you throw the water, there is blanching which is done to green leafy vegetables before serving it to your plate. So I would say a recipe like palak paneer is not a healthy recipe. Okay, because iron and calcium are binding each other and the absorption is decreased. There is a bioavailability of all the foods. So bioavailability in plant-based, it is more than bioavailability in milk. So थोड़ा plant-based का पल्ला भारी हो गया है यहाँ पे.
Mother, you broke my heart. मेरे घर पे आज पालक पनीर है, and now I have to change the menu for that, and I love
very
it.
happy.
Another thing in milk that we spoke is lactose. So lactose is the carbohydrate in milk, which is cutting down to glucose and galactose. Now galactose converting to glucose happens in the liver. So liver diseases, it is very difficult for the adult also, for children also, where the liver is not well developed. There the calcium digestion is hampered. Okay, and one more case where there is a myth that whenever there is high increased serum levels of calcium, there we avoid giving calcium. But no, that is coming from your bones. Your skeleton is the serum levels have increased because your body is taking the calcium from the skeleton.
Right.
So here, instead of not restricting the calcium, we should give good quality sources of calcium.
Right.
Okay, I'm not talking about the supplements here because they are easily digested. But where the natural process is happening, that is what we need to focus on. So good quality calcium comes with good intake of plant-based calcium sources because absorption is more. Milk is also being given, but if the patient is having liver diseases, then again it would be restricted. So to have a healthier bone, very rightly said that not just calcium but exercises is also very beneficial. Even the doctors would agree because the bone mineral density, if we see the graph with a sedentary lifestyle patient and one who's working out would be very high. Correct. So a balanced meal has been talked about. The composition of milk is talked about, and also other vitamins and minerals are also present in milk. So that also should not be compromised. Like B12, very vegetarian sources have a very low amount of B12, so we can give milk also, but in the recommended amount.
Right. So I guess at the end we all pediatricians, orthopedicians, physician and dietitian, we are on a common platform that milk is important but not a necessity, and there are other substitutes for milk which can be taken. So basically before 1 year absolutely no other milk apart from mother's milk. Up to the age of 5 years, if in case to be taken, it has to be a cow's milk, no buffalo milk or plant-based milk. More than no adding any Pediasure or Bonvita or anything, I guess, or sugar. It has to be sugar-free milk.
You can add either dry fruits,
Yes.
you can add
Fruits.
saffron.
Right.
Even plant-based beverages they have got.
Right.
The producers, they add fats and sugars in that.
Right.
Even they are very harmful and can lead to coronary vascular diseases in future.
Right. So I guess
producers-
class 1 has to be for the adults in case of cow's milk, but absolute no for a buffalo's milk.
Yeah.
And the most
additives.
important is the milk has to be not more than 2 cups a day, and to give your kids and adults too lots of green leafy vegetables, fruits, salads, dry fruits. We have seeds like sesame seeds, chia seeds, pumpkin seeds, ragi seeds, etc. So you can give other preparations which are high in calcium and iron to have a good normal growth plus your bone growth. So there are supplements available which can be consumed rather than milk itself. And most importantly is going out in sun before 11 a.m. for all of us for at least 15 to 20 minutes a day is very, very important.
Currently, I would suggest, considering the temperatures, I would rather suggest going before 7 a.m.
Okay.
The sunrise to initial, by the time it comes to a horizon, that would be the ideal time. Maybe
Okay.
from 6 sunrise to 7:30 maximum.
Okay.
After that,
Not
it's
to go out
useful.
inside.
Yeah, not useful, because currently the situation, especially in cities, metros like Mumbai, Pune, it's polluted, so
Right.
it does not work out that way. So it's before
True.
7:30, I would say.
Okay. True.
So one more no is for raw milk.
Oh,
Never give
yes.
raw milk. It causes
Yeah.
very serious diseases, life-threatening diseases. So it should
Okay.
always be boiled or pasteurized.
Yeah,
Right,
so
right.
one more thing, that is the homogenization of the fats. So the fats are broken down, and that is what is coming to us. So now we have the levels of milk available in the market because of the advertisement that this is A plus, this is A. But ultimately the amount of fat in the milk is also equally high because it is homogenized to you and
Right.
served to you.
And,
But yes, boiling,
Yes, please.
yes. So boiling will help in mixing. You can remove the malai out of it after boiling, so that can be recommended.
Okay.
What is the consensus about skim milk? Maybe low fat,
Yeah.
1%.
So up to
2%.
2
Less than
years,
2 years,
yes,
yes.
the brain development is happening. So you
Yes.
will require the fat. Give full milk. Don't give skim milk.
Yes.
After 2 years, especially just that you discussed, in families which have heart attack diseases, they have obesity, they have hypertension histories, those kids, the amount should be restricted, and you can go on skim milk or 1% milk
After 2
after
years.
2 years of age. Up
Right.
to 2 years for brain development, we need that fat. So 1 to 2 years, give them whole milk.
So what happens that less than 1 year, the BMI is towards on the higher side. After 1 year, still around 5-6 years, it is almost reaches the minimum, and then after 6 years, it again increases. BMI increases again towards adulthood. So what is called as at around 5 to 7 years, what happens is adiposity rebound. If there is a high intake, why I am saying about adiposity rebound, because if there is a high intake of milk in early years of life, less than 2 years, 3 years, then there is increased chances of an early adiposity rebound.
Okay.
So what happens that the child is obese at around 2-3 years, 4 years only. Maybe the child is 30 kg or 25 kg at around 4 years only. This translates into adulthood as well. If a child is 30 kg or at around 5 years of age, it will not be that the child will remain like that at 10 years also. Obviously at 10 years it will become 50 kg, at 18 years maybe 80 kg. So there are more chances of obesity, type 1 diabetes mellitus, more chances of non-communicable diseases as told. So that is why we are always saying that decrease the quantity of milk, not saying no milk. Decrease the quantity of milk. 2 cups means does not mean 2 big glasses. 200 to 250 ml is 1 cup. So it should be less than around 400 ml a day. So there has been study also done in which the kids who have drank more than 500 ml a day and those who have drank less than 200 ml a day, the study showed that there was a very increased incidence of iron deficiency, anemia, and maybe many other diseases in children who have drank more than 500 ml a day of milk.
So this is overnutrition that ma'am is talking about. So whenever there is a toxicity of any vitamin, so there is malnutrition. So what the mothers are doing, they are continuously feeding the children with the milk, like throughout the day. After 6 months also, like ma'am rightly said, that there should be weaning foods that are introduced and not milk. So milk after 1 year. So whenever there is a toxicity of any nutrition, the term is malnutrition. So even obesity is malnutrition, even undernutrition is malnutrition.
Right, because I have seen many of my patients getting their kids, they breastfeed the babies up to 2 years of age. And that is the reason the baby, because it is easy to fill their stomachs, they don't eat proper healthy food, and then eventually they lead to malnutrition and they are underweight and they have many other respiratory infections or other infections also.
Breast milk has IGF, so in insulin-like growth hormones, so they are very beneficial, and that is the only difference between cow's milk and the mother's milk.
Yes, but
which
then
is
they don't eat.
They don't eat. That is
Yeah.
one other thing. They are not introduced to other food.
Right.
So what happens is at 7-8 months they should be eating semi-solid solids.
Right.
If they don't learn at that age, they will not learn to push up food and push it back in their mouth. Once you don't learn this, till 1.5 years, you'll have to grind all the food and give them liquids, and everything will be pushed into the mouth. In the process, the baby is not learning how to eat. The baby is not getting enough nutrition. At 1 year, when you should be eating what your baby is eating, the baby is not getting that kind of food. So all deficiencies are there. The baby becomes ill, becomes repeatedly ill. So every time baby is ill, the weight loss happens, and this vicious cycle keeps going on.
Right. Okay, thank you all so much for being here for a healthy discussion. At least my concept about the milk became very, very clear, and I hope the listeners are also very clear with their thoughts that milk is important but not a necessity, and we should give other substitutes also to our kids and for ourselves for a good, normal and a proper growth. Thank you so much.